Hello, I'm Dr. Jake Abrams, and I was going to talk to you about a project that I'm doing at the moment. So I've come up with this thing called Get Better Books, and we've been creating some really wonderful books for children in hospitals across the UK. The project's all about creating beautifully designed interactive books and other things too, to help patients understand their treatment and get better, and really to make kids who are really poorly feel better. I've been doing this in collaboration with one of my fantastic alumni, Georgina Potier, who, as a child, had a kidney transplant at Great Ormond Street Hospital. And she, as an adult, wanted to use her creative skills to really help kids in hospitals understand their treatment and feel better. And so she came to me. It's me. I'm an associate professor here at Kingston School of Art, to get involved, to create some interactions that could really assist. Some of the medical communications that we both saw were just not really helpful at all, and some were just counterproductive, really. So we are designers and creators on a mission. We work closely with clinical teams to create interactions that really do make a difference. We've had amazing feedback from the things that we've been doing. From parents, from the kids, from the clinicians, from the play specialists, who've just really reported back on what we've been doing. And getting bits of communication to kids. So when they go into hospital, they get a present. They get a book with a gold envelope inside. They get a book. It's got a gold envelope, and it's a real treat. And whilst they go through these books, they really learn about their treatment journey, and have a laugh, and it's proved really effective, not just in the collaborations with Great Ormond Street Hospital, but also with just the wider community of their kids' siblings, the parents. Doctors have started and nurses have started to use these interactions as a really central tool in explaining to kids and their families what's about to happen. And we really learnt about anxiety, procedural anxiety in hospitals is really, really huge. And patients that are involved and understand what's happening could be far less anxious. And we really think actually this is a very cheap intervention, but it can really save hospitals money too. So if a child is more confident, they're less likely to kick off going into an operation, and so there are less delays. And so, just amazing feedback from these from kids and the patients alike. And we've been lucky enough to have been given these amazing awards. We won a DNA-DE pencil, which is a really significant award in the communication industry. We won a HP Inspiration Award, and the Gold Award in the Indigo Design Award, for these interventions to help kids. The books are interactive. Kids make the friendly animals within them come alive and be very, very personal. It's full of daftness, full of silliness, but really imparting some really important messages as we make them. Along the way, we've met some wonderful children, been working with fantastic children, and also we've been working with older children too. We've started to develop these passports that really help kids, older kids, have this very cool thing in their bag, but it really helps them understand what they're going through, and to be organised. And this word compliance, a lot of people, a lot of children, older children, forget to take their meds. I'm feeling better now, I don't need to take my meds. And actually up to 30% of transplants can fail because of a lack of compliance. And if our interventions can do something about it, then that's fantastic. So from transplant medicine, we've also moved on to cancer care, and we've got now 2 books that help kids understand that you can't catch cancer from anybody else. It's not your fault for having cancer. And so, really important interventions. We've been working with the teams that are working with kids with cerebral palsy at Great Ormond Street, and there's this Operation SDR, and it's, again, we're doing it with absolute irreverence and silliness, but also basing our knowledge on kids that have actually been through it. So this is a meeting that we had with brilliant kids that had been through the cerebral palsy SDR surgery, and clinicians and psychologists and play specialists as well. So and whilst doing that, we've also found that we can actually do other really good things. So speaking to clinicians about how kids with learning difficulties find hospitals particularly difficult, and so we invented some useful animations, again very unlike other NHS communications, that really help clinicians understand what kids with learning difficulties, autism or different needs are going through. Let me just hold that.
Just a few things to remember.
When working with children and young people with learning disabilities as autism or additional needs.
Be proactive.
E is for environment, physical and sensory environment.
Physical and sensory environment.
Spaces, places really matter to me. Stop!
So that's just part of one of the animations. We did a whole series of them that have really helped clinicians understand how to work better with those kids. And from our books and our paper interactions, which we really like and find really important, we've also been doing other stuff. So those animations, but also creating apps for kids in hospitals, again, to have lots of fun and silliness, but also for these apps to really help them through, understand what they've been going through. What's really nice from our interventions is we've been doing lovely work with Great Ormond Street, but more recently we've been working with other hospitals too. So we've broken out of Great Ormond Street and we're working with Nottingham, with Leeds, with Birmingham. There's a new book that we're doing with Newcastle, Liverpool, Glasgow, Cardiff, all sorts of other hospitals too. So there I am with Georgina just outside Alderhay in Liverpool. And so we've done this whole series of interventions, and there are more and more clinicians coming to us asking for us to play in similar ways, and so it's really rewarding, and really rewarding to meet some of the kids involved too. And because of the HP Inspiration Award, internationally too. So this was a version that we've done for German hospitals, and so that's getting really exciting, and we're going to be hopefully working in other countries too. And the whole premise of it is to make kids laugh, make them understand what's about to happen to them, make it a lot easier. And so that's what we've been doing. Okay, nice to meet you.